Hello and Assalamualaikum today everyone. Today our group will be presented about CPR and choking. I will be presented about CPR for the adult. Okay, CPR for the adult. First, we need to safety the assessment, check the scene and check the responsive from the patient. Second, call for help. Activate the EMS and call 911 immediately. And third is airway and breathing. Open airway and check patient breathing. Four, chest compression. Hand placement. Use heel of the hand, the lower half of the breastbone in the middle of the chest. For duration is at least 2 inches deep and at rate 100 to 120 compression. If needed, we need to mouth, and the last one, continue until medical expert come if it in emergency situation.
I'm Fatin Shaira binti Zaami, number metric 075702. I'm going to talk about CPR for children. Okay, first is safety and assessment. We need to check the scene and check the response of the patient, and then call for help, active EMS and call 911, and then airway and breathing. We need to open airway and check patient breathing. And next, chest compression. We need to use one or two hands based on child size. Duration about 2 inch. Compressing to 1 per 3 the depth of chest and at rate 100 to 120 compression. And then we need to, if needed, we need to do mouth to mouth. And the last one is continue CPR until medical expert come. And then
My name is Siti Ayuni Kristina binti Ibrahim and my matrix number is 075660, and I'm going to tell you guys about the CPR for infants. So firstly, for safety and assessment, we need to check scene and check patient's response. Second, we need to call for help by calling 911. The third one, we need to tilt the infant's head back with one hand and lift the chin to open the airway. And as for the chest compression, we need to do the compressions on the breastbone with the tips of 2 fingers. Give 30 compressions at the rate of about 100 and 120 compressions per minute. And we need to, if needed, we need to do CPR mouth to mouth and continue do it until medical expert come.
for the choking, for adult and children is the same thing. So I go first. First, we need to gently lower the victim to the ground, and then active EMS and call 911 immediately, and then begin CPR with compression without check pulse, and then during ventilation, inspect mouth for the obstructing object. If visible, carefully remove it with your finger.
The choking adult and of children, I will be continue the 15 part is 5. If object is not visible, attempt breathe and resume chest compression is unsuccessful. After 5 cycle of compression and ventilation, activate EMS is not done yet. 87 is the obstruction is clear, provide necessary rescue measure. And the last one, if victim recover consciousness, consider transport them to the hospital for the further evaluation.
Shocking unconscious for infants. Firstly, we need to call for help. If someone's respond, send them to activate EMS. Second, we need to place the infant on a flat, firm surface, and then start giving CPR. Start with compression, and then while delivering breath, check for the visibility of the object. If visible, turn the infant's head to the side and sweep the object out using your index finger. Avoid blind finger sweeps. And then after 5 cycles of compressions and ventilation, activate the emergency response system if not already done. And then if the obstruction is relieved, assess the infant's responsiveness, breathing and pulse. Administer rescue breathing or CPR as necessary. And lastly, if the victim is responsive, consider transporting them to the hospital to evaluate any potential injury from abdominal or chest thrust.
That's all from our group. Thank you.